Hello, my name is Shelby Basham. I am a nurse practitioner student with Northern Kentucky University. What brings you today?
Just a physical assessment.
Okay, great. Did they get your height and weight outside?
5'9", 135.
Perfect. Can you tell me your name?
Evelyn Riddle.
Evelyn Riddle. Okay, and what is your date of birth, Ms. Riddle?
April 23rd, 1991.
Great. Can you tell me where you're at?
Warren Hospital.
And what is today's date?
Today is November 27th, 2019.
Perfect. And who's the president?
Donald Trump.
And did I ask you where you were?
Yes.
Okay, good. Sorry. So we're going to go ahead and get started with your vitals. We're going to do your radial pulse first. I'm going to listen for 30 seconds. Okay, pulse is even and regular and at a rate of 70. Now we're going to do your blood pressure. Okay, 132/80. And now we're going to get your temperature. Oh, sorry. Okay, 98.6, perfect. And last but not least, your respiratory rate. So I'm going to watch your chest rise, just breathe normal, and I'll watch it for about 15 seconds. Respirations are at 16, which is normal and good. So we went ahead and reviewed your system. You're not having any complaints of pain or any ailments. Perfect. Okay. So we're going to go ahead and get started. We're going to start at the head.
Okay.
So I'm just going to take a look at your hair. Looks nice and clean. No patches or anything. Now I'm going to feel on your head. Just feel for any tenderness or any nodules. Is that anything hurting you?
No.
Okay, perfect. And now we are going to move on to the eye exam. So I'm going to have you take a look at this chart.
Okay.
Do you wear corrective lenses or glasses or
I do
anything?
not.
Perfect. So just take a look at this chart and read the smallest line that you can see clearly.
LTFPH.
Perfect. Now cover one eye.
LTFPH.
Okay, now the other eye.
LTFPH.
Perfect. So you have 20/20 vision in both eyes without corrective lenses, so that's great. Now we are going to do sorry, my table's a little squeaky. We are going to do the H test. So what I'm going to have you do is just stare at my pen and then without moving your head, just follow it with your eyes. Perfect. Okay, now follow my finger. Without moving your head, just follow it with your eyes. Perfect. And that you have no nystagmus, no issues there. And then we're going to bring it in and test your pupil reflex. Okay, that one looks good. Both pupils are round and react equally to light. And now we're just going to take a look at the sclera. I'm going to go ahead and look straight forward. Conjunctiva is pink and moist, and the sclera is shiny and white. And now I'm just gonna look into your eyes, check your red reflex as well as your optic disc. So just stare straight ahead, and I'm going to dim the lights. Okay. And looking at her right eye with my right eye. Okay, red reflex is present there with an optic disc is sharp. Now looking at her left eye with my left eye. Sorry. Okay, red reflex is there. Optic disc is sharp. I'm gonna turn the lights back on. Got it. Okay. Now we are going to do the ears. So I'm looking at the outer ear, making sure that they are symmetrical, that the outsides there's no drainage or lesions present. Now, if you don't mind, I'm just going to palpate them and let me know if you feel any tenderness.
No.
Okay, good. Now we're going to take a look in the internal ear, at the ear canal. Have you been having any pain or any issues there?
No.
Good. I'm going to pull the pin back and look in. Tympanic membrane is translucent and pearly. Looks good. No drainage or extra earwax buildup. I'm gonna look on this side. Pull the pin back. No. This tympanic membrane is also translucent and pearly. And again, no excess drainage or earwax buildup. So from here, we're just going to test your hearing. This is called the Weber and the Ryan test. So I'm going to hit this this little tuning fork here and place it right here on your forehead. Let me know if you hear the sound in both ears, if it's louder in one or the other, okay?
In both ears.
Okay, equally?
Mm-hmm.
Perfect. Okay, now I'm going to put it behind your ears and you let me know if you hear it, when you hear it and when it stops, okay?
Okay.
Does it stop?
Mm-hmm.
Perfect. Okay. You hear it?
Mm-hmm.
Let me know when it stops.
Okay.
Now we're going to move to the other ear and do the same thing. Let me know when it stops.
Okay.
Let me know when it stops.
Okay.
Perfect. Okay, so that both of those were good. Your air conduction, bone conduction tested well. And now we're going to move on to your nose. So I'm just going to look at the external structure of your nose. It looks symmetrical. It's midline with your face. Now I'm going to just palpate on it and let me know if you feel any tenderness.
Nope.
Okay, great. And I'm going to palpate your sinuses.
Okay.
Let me know if you feel any tenderness with this.
Mm-hmm.
Okay, great. Wonderful. If you don't mind me, I'm going to put my gloves while we look at the internal structure of your nose. Looks good. Septum is midline, no deviation is present. There's no excess drainage in your nose. And I'm gonna have you close your eyes and smell this for me. Let me know what you smell.
Cinnamon.
Perfect. So your sense of smell is intact. And now we're gonna move on to your throat and your mouth. Go ahead and have you open up wide, please. Say ah. Okay, teeth look good, dentition's good. I'm gonna have you lift your tongue for me. Great. The soft palate is free of lesions and moist. Go ahead and put your tongue back down. Open up wide. The hard palate looks good as well. The buccal mucosa is pink and moist and free of lesions. I'm gonna go ahead and have you put your tongue out. We're gonna test your gag reflex. You gagged, right? Okay, now put your tongue out for me. Okay, now move it side to side. Okay, also with your mouth closed, put your tongue in your cheek, push out. Great. And then from here, I'm gonna have you puff out your cheeks. Great, smile, frown, raise your eyebrows, please. Perfect. Okay, now I'm gonna have you shrug your shoulders. Great job. Now turn your head side to side for me. Looks good. So we're gonna move on from there. That was the head and neck, or that was the head, ears, and nose and throat. So we're gonna move on down to the neck. Just gonna palpate the outside of your neck, palpate the carotid artery. Okay. I'm just gonna listen quickly for any worries with the bell of my stethoscope. Okay, sounds good. Okay, I'm gonna have you swallow. Okay, now I'm gonna go to the back and feel for your thyroid. Just go ahead and swallow for me. Okay, thyroid is medial, does not feel enlarged. Was that any tenderness or anything that you felt?
Nope.
Perfect. Okay, so that looks good. From here, we are going to move on to the lungs. I'm just gonna take a listen to your lungs real quick. Just breathe normal for me. Okay, deep breath. Perfect. Okay. Perfect. Raise this arm. Okay. I'm gonna go to the back and listen there as well. Normally in a normal physical exam, we would listen to at least 3 breaths, but for town purposes, we are only listening to show the landmarks. Big deep breath. Perfect. Okay. Sounds good. Both your lung sounds are clear. Bilaterally, your chest is symmetrical. There's no evidence of labor or breathing there. And from here, I'm going to go ahead and listen to your heart. But first, I'm going to feel for your PMI right at the mid-clavicular line, 5th intercostal space. It's felt. And then we're going to move on to the heart. First, listening with the drum of my stethoscope at the aortic, pulmonic, tricuspid, and the mitral. Okay, I heard no murmurs or thrills. Now we're going to listen with the bell, the aortic, the pulmonic, and tricuspid, and the mitral. Your heart rate sounds normal. Again, no murmurs or thrills heard there. Now I'm going to go ahead and have you lay on back for me. We're going to assess your abdomen real quick. Pull your belly up. Abdomen is normal color and no masses or anything noted. I'm going to roll that back down for you, and then listen to your bowel sounds. In all 4 quadrants. I've listened for at least a minute in under normal circumstances. Bowel sounds are normal, active in all 4 quadrants. Now I'm going to listen to the aortic arch with the bell. No breeze heard. And now I'm just gonna palpate deep into your abdomen. Let me know if you feel any discomfort or pain. Okay. Abdomen is soft and non-tender. No guarding or rebound tenderness felt. And from here, we're gonna move down to your peripheral vascular as well as some of your range of motion. So if you can go ahead and lift this leg up for me, hold it for 10 seconds. Great, now bring it out. Perfect, back in. And try to bend at your knee up to your chest. Great, bring it back down. Same with this leg, up 10 seconds. Okay, out. Back in, bend at the knee. Great job. Any pain or clicking or anything with that? Great. So normal range of motion in the legs, and then we're gonna move on, look at the skin. It's normal for her ethnicity, looks well hydrated, skin turgor is intact, no pitching or tinting noted. Same with both of the arms, looks good. So here I'm gonna have you pull back against my hands, great. Push down on my hands, perfect. I'm gonna have to remove your socks to check your capillary refill, okay? Capillary refill returns within 2 seconds, looks good. I'm gonna go ahead and test her pulses while we're here, so her dorsalis pedis. Great. Her posterior tibialis. Looks good. And I would do the same on the other foot as well with capillary refill as well as her pulses. So you can go ahead and sit on up for me, hun, and put your sock back on. And while we're here, we're just gonna take a look at your arms because we didn't do that range of motion. So just hold them up for me. No drift or any issue there. So we're gonna have you bend at the elbow. Okay, now pull back against me. Great job. And right now we're gonna go on to sensory. I'm gonna have you close your eyes and I'm gonna use, this will be the sharp sensation you feel, and this will be the dull. Just let me know if you feel sharp or dull. Okay? So close your eyes for me.
Sharp, dull, 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 sharp, sharp, dull, dull, dull,
And cross your legs, hun. Thank you.
sharp, dull.
Okay. And now we are going to just test and just your overall sensation. Just let me know if you feel this or not, okay?
Yes, 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 yes.
Perfect. Okay. Moving on, we are going to test your reflexes. Okay. I'm gonna feel for your tendon and just rest your arm normally, okay? Perfect. Perfect. Now moving on to the patellar. Great job. Okay, now moving on to the Achilles. You have to excuse me, my knees do pop. Great job. Okay, all reflexes are intact. And from here, we are going to have you stand up and move your shoes out of the way so you don't trip, hun. I'm gonna have you walk heel to toe to that cabinet, please. Her gait appears to be normal. She does not appear to be off balance. Have you walk back normally, hun. You don't have to heel toe. Great job. While you're here, I'm gonna have you close your eyes and just stand still. Check your balance. Okay, your Rombo test is good. You can open your eyes. You're not off balance. Your proprioception is within limits.
Okay.
I'm gonna have you turn around and bend over so I can check your spine. Okay, your spine is midline. Does not appear to be protruding in any way. Any tenderness with me palpating there, huh?
Nope.
Okay, perfect. You can stand on back up. And just rub your heels to your shins. Great. Perfect. So everything looks good. Go ahead and take a seat for me. Everything, so overall, you do appear to be generally healthy. I'm not showing any abnormal signs on this physical. I think that we're safe to say for you to come back in about a year for your next physical. If there's any issues between now and then, please feel free to give us a call and set up an appointment. For a normal physical exam in the hospital setting, we would go ahead and do the breast exam for a young female, having her lay back and raise her arm and checking for any lumps or masses, as well as a yearly gynecological exam. And that's it, I think.